Okay, this is interesting. So we have the last question by Dr. CHIALI just now. So I'll invite Dr. CHIALI. Do you want to explain the case that you had? Was it yesterday?
Hello.
Hello.
Yes. Good afternoon, everybody. Yeah, I had a case like I wrote right now. Yesterday, among the 30 eyes I had yesterday, and one case on one eye, I did everything, my routine procedure, and suddenly I didn't have any energy in this eye, no energy at all. So I was stuck. What I had to do, because I can't move, surgically going into it for heart. I didn't have, no. So what I did is to trick the laser, and I gave him another name with the same seeding as it was for this case, and retreating again, and washing, wiping like you do all the time, and this time it was working. So the first time didn't work, and the second time was working, and the procedure was the same. And this works with normal energy. I didn't change anyone. And the next day, 2020 on this eye. So what happened?
So on the first time, when you say there's no energy, you mean there were no bubbles? There was no bubble formation. Is that what
no bubble, no bubble, nothing to see.
For the lenticle cut, or for the cap cut, or for both? No bubbles.
For everything.
For nothing.
Everything. I didn't have any energy.
I would love to see the video of that. Can you transfer the video to us?
I can send you the video, Dan.
Send it to us, and we can discuss it next week, because we have the black spots lecture anyway.
Okay.
So that would be great. Yes, here. Just email it here.
Sure.
My email at the bottom there.
But the cases was very well done, since the patient got 2020 the next day. That was I didn't expect that,
Yeah, well, from your description, I didn't expect it either, but
yeah.
Send us both videos. Yeah, send us the video, the failure and the success, both of them.
Sure.
But it does bring up an interesting point, is that, and we'll talk about this a lot next week, that if you do ever create a lenticle interface, a bubble pattern in the lenticle cut, and that bubble pattern is not smooth, or it's not complete, you should never attempt to repeat a lenticle cut at the same depth again, expecting the bubbles all to match up exactly the same. Because there is a chance that you can be slightly off and you end up with slithers in what is, again, a refractive cut. There are ways around this. You can change the depth of the cap and things like that. And this is something that Dan's going to talk about during the suction loss talk next week as well. Now, we do have a lovely case from one of our participants on the course. Thank you very much to Dr. Abdul CHIALI, who actually was very kind enough to mention his case last week, where he did have a very strange bubble pattern during the surgery, which he wanted to share with us. So just to show you, this is his laser settings. Again, no point in looking at them, because ultimately this is what's good for his laser. But if I show you the video, it's quite interesting to see what happened. What happened firstly is that he docked and he put his foot down, and there were practically no bubbles. No bubbles formation in any of the picture. I'm going to show you the video in a second. So what's interesting is we're going to ask ourselves, was there enough meibomian oil on the surface of the eye that it actually blocked almost all of the bubbles being created in the first place? Or, and I hate to say this, but maybe there was a laser data entry error where the laser energy was just very, very low, or the spot spaces were very, very wide, that we didn't generate enough bubbles. So I think the laser settings were fine. So this could be a case of an excessive amount of meibomian oil on the surface of the eye. So I'm going to play this little video, and we're going to see, this is like beyond plasma threshold if you were trying to reduce energy, because there's practically no bubble formation. What you're seeing now is the lenticle cut being created. It's practically no bubbles, hardly anything. You can see a few little bubbles over here. You're going to see the side cuts of the lenticle, just about, because the bubbles are one on top of each other. Now we're seeing the cap cut. That's the full bubble pattern of the cap cut. And then finally, you're going to see the little excision on the side, because again, the bubbles are stacked up on top of each other. Now I'm going to pause the video over here, because truth be told, if I was performing a case like this, and I noticed that there was very poor bubble formation on the lenticle cut, and I've got a very thick cap, I would have aborted. I would have created a scissor already at the beginning when I could see there was hardly any bubble formation. Because clearly there's something going on here. If I've got that much meibomian oil in the interface, it makes sense for me to redock, re-wipe the cornea, maybe even flush with a bit of BSS, and then try again with a new contact glass. At the same time, check my energy settings and my spot spacing to make sure that there hasn't been a little error there, that I was suddenly operating at a very low energy, for example, by accident. And at that point, if you've got a thick cap, you can opt to make a thin cap smile and repeat the smile. You can never, or you should never, repeat a smile at the same depth as the original smile, because if you create two lenticle cuts at the same depth, you have the high risk of creating slithers if there is a slight misalignment in the depth. So actually, Dr. CHIALI did that. He did create a new smile lenticle, and you'll see here, much better bubble pattern, although there is still a dark spot, and I'll cover that dark spot in a second. You can see the dark spots over here. So this is definitely meibomian oil, which is masking the ablation. But creating the lenticle at exactly the same depth, he was able to remove this lenticle, and fortunately there were no slithers, and got a very good visual outcome. I'm simply going to point out that even with this level of bubble pattern, with that dark spot, I would have aborted the case again, and I would have switched to LASIK. And you can see over here that during the dissection, one of the things that possibly helped is that he used the broad side of the instrument to move through the bubbles where there was a dark spot. And by doing so, you're much less likely to create a false plane in the process of dissection. But again, this was just a very, very super lucky outcome that the patient had a really good result, because ultimately the risk of slithers by creating two lenticles at the same depth was quite high. One should never do that because of that risk. And then, because that's almost impossible to fix, by the way. And then the second part is, if you have a dark spot, rather switch to LASIK because of the risk of creating a false plane and creating an irregular lenticle. So thanks very much for that contribution, Dr. CHIALI, because again, this just shows you these cases do arise. They're not that common, but they're common enough for us all to have to bear that in mind and pay very, very close attention to those bubble patterns at all times.